Hello everyone, welcome to my channel. Today we'll be talking about some of the side effects of insulin treatment. Definitely mainly focusing on side effects of insulin treatment, including injections and pens, instead of like an Omnipod or with another medical device. So aside from the common side effects of insulin therapy, which is weight gain, hypos, stuff like that, we will be talking about things including pain, sometimes bruising, and things from that kind of sector. So yeah, let's get started. Some things that people don't mention when they're introducing you to insulin therapy through injections is that it can hurt. It shouldn't hurt all the time because injecting should be painless if you are doing it right. But it can hurt if you accidentally hit a nerve despite following all of the rules and conditions that you were told. So when you hit a nerve, if you can handle the pain while injecting the insulin, everything should be fine. They're very thin nerves, so it shouldn't really affect anything. But if you can't handle the pain of injecting insulin if you've hit a nerve, then it is totally okay to retract the needle and pierce the skin over again. One of the other side effects that I see a lot of people struggling with, including myself, is insulin leakage. It is not uncommon for people to have their insulin leak after injecting it and once they pull out the needle. But what we want to do to refrain from this, since 1 to 2 drops of insulin is around a single unit, and if you are taking your insulin to the T and you want to take the full dose, obviously, you would not want to lose any insulin. So what I do and what I recommend is holding your skin as like in a pinch motion. Pinch the part of your skin that you're going to inject and hold your needle at a 45-degree angle. That won't fully eradicate the chances, but it will definitely lessen them, and it'll lessen the chance of leaking your insulin. What I also do is I try to inject very slowly. So combine all of these 3 things. So pinch the area where you're injecting and hold the needle at a 45-degree angle, then you should be okay, and hopefully it'll reduce the leaking that you're experiencing. Now, some doctors or some people would say to stretch your skin. So if you have your skin here, usually you would like stretch it like this, but I've heard that it can cause other medical problems and it won't fully eradicate the problem as well. So the safer alternative is to just hold your needle at a 45-degree angle and pinch your skin and inject the insulin slowly. Another problem that might not be as common is blocked needles or stuck needles. So when you give yourself long-acting insulin, sometimes the needle might get stuck or blocked. So this happens because of the crystals that the insulin makes when you are injecting yourself. And this can also happen if you're injecting your insulin very, very slowly. So more than 5 seconds is how slow we're talking. Usually it is better to inject it faster to avoid blocking the like letting your insulin crystallize. But it's also can happen when you reuse the same needle often. First of all, as a sanitary practice, you should mandatory be changing your needle every time you use it. You can change it. You can use it twice before you change it if you're doing it directly in the skin. But if you are putting it through your clothes, I would recommend to change it right after you use it as sanitary precaution, but also to prevent your insulin from crystallizing and blocking your needle, which allows the insulin to be absorbed better and allows the needle not to get stuck in your skin. The last thing I'll be talking about today is bruising of the skin. Now, although this is the last thing I'll be talking about in this video, it's definitely not the last side effect of insulin treatment. So I will be making part 2 talking about the others. And if there are more side effects that I can cover, I will make more parts after that. But yeah, so bruising under the skin can happen when you inject a blood vessel, or it's a very, very small blood vessel in the subcutaneous fat layer right in between your skin and muscle. The good thing is that these blood vessels are super small, so there is no chance for insulin to go through them, but you may bleed a little bit, and then it's totally okay. Sometimes the bleeding can create a tiny bubble under the skin, but there's no major side effects to this. The bleeding will go away, it'll stop, and the bruising should go away by itself. It is just one of the minor side effects that some of you guys might see while injecting yourselves and might worry about, but it's definitely not something to worry about. It's very temporary, and it's just another thing that can happen if you inject your insulin in the wrong way. That is it for today's video. Next part, I can talk about fat lumps that may happen under the skin, redness after injections, and many of the other side effects while taking insulin treatment. But for today, I hope you enjoyed this video, and I hope you were educated and were informed about new things that you didn't know about type 1 diabetes, and I'll see you in the next one.